Thank you for taking the time to join us today. It's my pleasure to introduce today's speaker, Dr. R.M. Chabra, Senior Consultant Physician at Max Hospital, Shalimar Bagh, and Saroj Super Specialty Hospital, Rohini, and Director of Chabra Medical Center at Pitampura, Delhi. Dr. Saab is also holding some of the awards, recognitions like Sundarlal Rupati Award given by Delhi Medical Association 2005, WCC PGC 2008, Distinguished Service Award by APJ Abdul Kalam, Sudarshan Grover Award by Delhi Medical Association 2009, DDF Academic Excellence Award by Delhi Doctor Forum 2021. Dr. Chabra brings with him years of clinical expertise and deep insight into internal medicine and related field. Today, he will be sharing his knowledge on a very relevant and thought-provoking topic, that is oxidative stress, infertility, role of antioxidants really matters. Without further ado, I invite Dr. Chabra to take us through his presentation. We look forward to engaging and enlightening session. Over to you, sir. Dr. Aram Chabra.
Thank you, Mr. Vicky Kapoor, for giving for the kind words. First of all, I would like to thank you, Survey Pharmaceutical, and the Mr. Vivek Sharma for giving the opportunity. Thank you very much. So today, our very interesting topic, that is the topic is our just a minute. So this is my disclaimer. And today I have been allotted a very interesting topic, that is the oxidative stresses and inflammatory role of the antioxidant really matters. It is very, very important topic. This is organized by the Survey Pharmaceuticals. So, dear friend, what is the infertility? Definition of the global burden. Infertility, failure to achieve the pregnancy after 12 months of the regular unprotected intercourse. This is unprotected intercourse. Then it is infertility. Infertility. What the cases of the infertility are increasing in this modern era in the male as well as in the female, both. It affects around about nearly 15% of the couple worldwide. One in six couples experience the infertility during their lifetime. Male factor 30 to 40%, female factor 30 to 40%. Is a combined and unexplained factor, that is a 20 with the tune of the 20 to 30%. There are so many psychological causes to the pathophysiological reasons which requires the early diagnosis and the treatment to keep the fertile, both male as well as the female. This is the factor. Key point. Causes of infertility in the male: low sperm count, poor motility, abnormal morphology, varicocele, hormonal imbalance, oxidative stresses, which we will discuss. And then the female, ovulatory disorder, that is the PCOS, and tubal blockage, endometriosis, and the diminished ovarian reserve and uterine abnormality. These are the factors. Today we will discuss about the oxidative stresses. So, dear friend, clinical and social impact of this infertility, psychological stress and the emotional burden, marital strain and the social pressure. आपने देखा होगा, हर बार पूछते हैं कि कब बच्चा कब कर रहे हो. Increase the anxiety and the depression, rising age of the marriage and delayed parenthood and life disorders, obesity and the diabetes, environment factor, toxins and the urban stresses. Infertility is a shared couples condition, not gender specific. So, dear friends, you are seeing so many in fertility centers on IVF, IM. So many centers are coming up because due to the burden of the infertility all over the world, especially in the India. So, dear friends, before going to my topic, I would like to tell you something about our life. What is the human life? Human life of the age, it starts the cycle from the birth to the earth. So to keep ourselves healthy and fit throughout the life is an art. If you know the art, then you can keep yourself healthier. Otherwise, you cannot. So health and fitness are the interrelated terms, and personal health, as per definition, when person physically, mentally, socially, and spiritually healthy, then you can say person is healthy. If person is stress free or the healthy, then the person is stress will be fertile and immunity will be the strong. That is the funda. So, what are the sources of the energy which keeps you stress free, healthy, fit, and give the better performance? That is, you require the food daily, diet and nutrition, the carbohydrate, protein, fat, minerals, and the vitamins, and air. Air is very, very important. You have seen the importance of the oxygen in the COVID era. And sleep, adequate sleep is very, very important. That is from the 6 to 8 hours of the day. If you oversleep or the undersleep, both are harmful for you. You are not alert in the morning if you are under or the oversleep. Then the exercise and meditation and the yoga. I will not talk about this. Everybody knows about the importance of the to keep yourself healthy. So water and fluids are also important. That's why we say the fluid and electrolyte balance. It should be there. Otherwise, you will go into the dehydration or the overhydration. That is both are harmful for you. So, dear friends, it is a myth that health and the fitness comes from the medicine. Always think medicine खा लेंगे healthy हो जाएंगे. No, health does not always come from the medicine. Most of the time, it comes from peace of the mind, peace in the heart, and peace in the soul. It comes from the laughter and love. That's why we always say laughter is the best medicine to keep yourself healthy. So, dear friends, what is the importance of the muscle? Nutrition, muscle mass, and the immunity are closely linked. Nutrition, adequate nutrition is fundamental for maintaining the muscle mass and the normal immune function. So, if there is a muscle mass less, the immunity will be decreased. Normal immune function, if the normal nutrition is there, balanced diet is there. So, what are the sources of energy which keeps ourselves stress free, healthy, fit, and that gives the better performance? That is the natural. We get the vitamin D from the sunlight and the food. All the things are from the food, either the non-vegetarian or the vegetarian, carbohydrate, protein, fat, mineral, and the vitamins. And if there is any deficiency of any nutrients, then we require the exogenous supplement. That is a nutraceutical important. So, dear friends, then the pharmacotherapy may be there to supplement in the form of the other tablet, liquids, injectable, capsules, sublingual strips, or the powders or the fortified foods. They all are a supplement that is required to keep yourself healthy. There is a deficiency of any nutrients or the carbohydrate, protein, fat, or anything, or the mineral, the vitamins, or antioxidant you require. So, dear friends, poor nutrition and the compromised immune system, you see, if there is a poor diet due to any reason, hectic, stressful life, sedentary life function, and restricted diet, fast food, low income, or the lack of the availability of the food, they all way to the suboptimal nutritional status. Ultimately, what will happen if there is additional factor like the pollution? We are in the metro city, all pollution, cigarette smoking, all will lead to the chronic stresses or psychology, sleep disturbance or the deprivation, and the excessive alcohol, the consumption or the prolonged excessive exercise, all will lead to the compromised immune system. So always decrease, increase the risk of the infection if the immune system is compromised. So, dear friends, nutrition is very, very important. So, how is our health is affected? Inactivity, imbalanced diet, or the oxidative stresses all will lead to the lifestyle diseases or the mental diseases like the diabetes, obesity, hypertension, depression, the anxiety. So, dear friends, what do you require? If there is deficiency, then you require the balance nutrients, fresh air, proper sleep, exercise, antioxidant along with the preventive measure are required to keep ourselves healthy. So, dear friends, today we will talk about the antioxidant, my topic. So, antioxidant may be exogenous or the endogenous. We will talk about the exogenous antioxidant today. So, dear friends, oxidative plays a key role in the development of the lifestyle disorder. These are the microscopic disease or the disease, all the disease. So microvascular disease, cerebrovascular disease, hypertension, all the sanitary due to the sanitary lifestyle, genetic predisposing, smoking, unhealthy diets, or the obesity, the overweight, all will lead to the oxidative stress is linked with the disease, diabetes, hypertension, or the diabetes mellitus, and ultimately lead to the if they have the disease, what will happen? Person is infertile, either male or the female, both are infertile due to these disease. So, dear friends, today is our topic. I will talk about the energy crisis in the female reproductive system. What is the infertility in the females? You see the infertility. So, a woman fertility by the age, with the age, the woman age of 22 to 5 years, the fertility is the 85%. Above the 30 years, then it will decrease to 75. If the woman is the 35 years, it will lead to the decrease to 66%. If over the 40%, then this is a 44. That's why we say the elderly primary, because fertility is very, very decreased, the almost less than 50%. So, dear friends, in reproductive age, the woman PCOS preventive very significantly by the diagnostic as you see these are NIH, the Rotterdam or the AC. These are the studies, and it will increase rising global infertility over the last 30 decades. So from the 90 to 2020, it increased the number of the cases. So metabolic abnormality in the Indian women with the PCOS that will increase the insulin resistance with the tune of the 65 to 70%, dyslipidemia 55 to 60%, and uh, anti-mulin hormone that is 72%, and chronic low grade of the inflammation that is 60%, and vitamin D deficiency 40 to 50% all lead to the infertility. So the rising epidemiological burden in the reproductive age of the women, you see infertility rates are rising globally. About 1 in 6 couple worldwide face the infertility. Factors include the metabolic issues, oxidative stresses, over in aging, and women are experiencing early reproductive declining when with the normal hormone levels, and PCOS, the most common endocrine disorder in the women, affect the 60 to 30% women worldwide, and 70% of the cases go undiagnosed, delaying the treatment. South Asian women often experience the more severe metabolic issues, including the insulin resistance and the dyslipidemia, even if they are lean, because there's a phenotype. So the metabolic stress is as a key factor. High androgenic and the hyperinsulinemia speed the mitochondrial dysfunction in the granulosa cells, and elevated ROS reactive oxygen species in the follicular fluid lowers the oocyte quality, and blastocyte incompetency, and ongoing inflammation and the metabolic issues reduce the ovarian response to stimulate. So the clinical insight, the prevalence of the PCOS metabolic syndrome and the early energy decline is the increasing, making the biogenetically failure in the central driver of the subfertility. So, dear friends, the hidden biological crisis behind the female, that is the mitochondrial oxidative phosphorylation, and is essential for the germinal vesicle to metaphase, the second transition, and chromosomal segregation, and the spindle integrity, and the cytoplasmic maturation, oocyte competence for the fertilization, early cleavage stage abdominal development. These are required. So the contemporary women exhibits the premature mitochondrial dysfunction due to the insulin resistance to the hyperinsulinemia, PCOS, associated with the chronic low grade inflammation, elevated reactive oxygen species, ROS in the follicular micro environment, and metabolic overload and the dyslipidemia, environmental oxidative stresses, and leads to the NADA nicotine deoxide denucleotides depletion leads to the impaired mitochondrial biogenesis and decrease the ATP availability within the oocyte, that will impair the plasmic maturation, higher rate of the embryo fragmentation, and low implantation potentially, and reduce the clinical pregnancy success in the ART cycle. So, dear friends, key insight, reproductive outcome begins to decline when the cellular energy declines, often years before hormonal changes appears. So the biological drivers behind the disrupted ovarian function, you see the insulin resistance and the hyperinsulinemia, then The chronic low grade inflammation with these are the marker TNF and all that, and oxidative stress is ROS accumulation that will damage the mitochondrial oocytes maturation and the abnormal meiosis, second oocytes and dyslipidemia and the lipotoxicity, free fatty acids, mitochondrial overload, apoptosis there, and lipid peroxidation, poor oocyte quality will make the poor oocyte quality and altered energy metabolism, NAD disruption, AMPK, poor follicle recruitment, embryo quality. So reproductive dysfunction is a metabolic disorder mediated by the inflammation, oxidative stresses, and the mitochondrial damage, not purely hormonal. So, dear friends, what is the mitochondria? What is the role of the mitochondrial parameters that determine the oocyte competence? You see, the mitochondrial biogenesis increase they greatly from the antral stage, raising the DNA couples as the oocyte competence grow and ATP production also surge during the GV and the mill transitioning key cells process oocytes will also with the low mtDNA or the poor mitochondrial function at the late stage have lower fertilization and the embryo successful. So these are the clinical impact of the fertility. The mitochondrial membrane potentially and the copy. These are the I will not go to the detail. This is a busy slide. So I will come to the picture points. So this is a picture where is the NAD that is the nicotinamide adenine dinucleotides uh, repletion, female fertility during the reproductive aging. So you see this picture. So age mouse and the age mouse. So NAD declines or the reproductive aging evidence from the NMM, NMN research and what is the NAD does in the oocytes regulates the mitochondrial oxidative phosphorylation and maintain the meiotic spindle stability and supports the ATP synthesis during the maturation and activates the SIRT1 and the SRAT3 pathway for the mitochondrial repair and protect the oocytes from the oxidative and the mitochondrial. So these are the observation, then the scientific outcome age reduce the NAD level in the oocyte that will decrease the mitochondrial membrane potentially and the ATP and nicotinamide mononucleotide supplements restore the NADA. So this is the precursor of the NADA. NMN, that is a nicotinamide mononucleotides. These are the precursor of the NAD. So it will increase the mitochondrial function and the ATP synthesis, improve the mitochondrial performance that will increase the oocytes quality, better mitotic alignment, and enhance the embryo development and increase the blastocyte formation rates and rescue the age-related fertility declines. That will the scientifically outcome a significant improvement in the pregnancy outcome. So these are the things. So NAD levels drops with the age, harming the mitochondrial and the oocyte quality. NMN restore the NAD, boost the mitochondrial function, reduce the cell damage, and improve the ovulation and the oocytes health in the aging ovary. So, dear friends, why the stilbenes are relevant in the female reproduction? What is stilbenes? So, why this matter in the gynecology? It enhances the mitochondrial biogenesis and reduces the ROS and the oxidative injury in the follicles, and it supports the granulosa cell metabolism and also improve the folliculogenesis and the oocyte competence. So modulate the inflammatory cytokines that will reduce by the stimulants. So still beans are the plant derivative polyphenolic components widely studied for the antioxidant, anti-inflammatory, and the mitochondrial modulating action. So there are two major biological active stilbenes, that is the resveratrol and the pterostilbenes. These are two very very important. Out of the two, the tero stilbenes means highly bioavailability with this steel beans. So the natural sources found in the predominantly in the Japanese note wheat, grapes, red wines, blueberry, peanuts, and certain tree barks. These are the very very important. So these are feature of these two uh, resveratrol and the pterosteel beans. These are the bioavailability low in this and it is high. And that is a strong, that is stronger. Antioxidant capacity, the resveratrol is high, then is higher due to the methylation. So mitochondrial biosynthesis, these are the benefit of these two steel beans. So what will happen? Still both resveratrol and the steel beans that will increase the activity, that is the SIRT1, that is known as silent regulator 1, and the PGC1 alpha, that is the peroxisome proliferative activation receptor gamma co-activator 1 alpha. So they will increase, and they will increase the mitochondrial biosynthesis and the oxidation OX force efficacy, and they will reduce the ROS and the oxidative damage, and they will also reduce the inflammation, that will improve the glycosyl function and the follicogenesis, and will increase the oocyte mitochondrial ATP and the competency, the better fertilization there, and lower fragmentation, the higher quality of the embryos. So this is the mechanism of these skill beans. So these are picturization of both mitochondrial dysfunction. These are pictures. I will this. I have told you this algorithm. So the stilbens like the resveratrol and the pterostilbenes active the SIRT1 and the PGC 1 alpha pathway, boosting the mitochondrial function in the granuloma or the oocyte cells. So this also reduces the oxidative stress and improve the follicular environment, adding to the oocyte maturation and increase the mitochondrial ATP, enhancing the fertilization rates and the embryo quality in the art cycle. So what is the importance of the immunometabolism and the lipid remodeling or the hidden driver of the ovarian dysfunction? You see why the immunometabolic matters in the reproduction. The ovarian follicle exists within a high regulator immunometabolic microenvironment. Immune signaling directly influences the lipid metabolism, which in turn impact the granulosa, cell stability, and the mitochondrial integrity, and oocytes development competence, and also disturbance in the lipid remodeling imply imply the oxidative stress and the mitochondrial dysfunction. So, what is the immune parameters? Then immune tolerance, allow the trophoblast invasion and decrease the inflammation, decrease the infector immunity, and increase the blood vessel remodeling, and also increase the residual response. So these are the effects of the immuno, immunometabolism matter. So maternal immune regulator implantation, that will successful implantation require the tolerant low inflammatory residual immune environment and residual NK, uh, DNK cells support the trophoblast invasion and the spiral artery remodeling, and they are pro-inflammation, not cytotoxic, and T regulatory cells maintain the maternal fetal immune tolerance and prevent the excessive Th1 driven inflammation. Macrophages and the tolerogenic dendritic cells coordinates tissue remodeling and the promote the immune tolerance. Imbalance of the NK and the TRAG activity leads to the implantation of the failure, poor decidualization, and the early pregnancy loss. So these are NK cells. These are the cells. What is the mechanism that will lead to the poor implantation, decidual instability, higher oxidative stress in the ovary, and assure with the RIF recurrent implantation failure. And T cells. These are the mechanism of the T cells. They impair the polygon development, reduce the endometrial susceptibility or the high risk of the recurrent pregnancy loss. So, what is the PCOS? A metabolic mitochondrial disorder, affecting the ovarian function. So this is the picturization for the mitochondrial biosynthesis regulated. These are the regulated by the PCG and the one alpha and the NRRP. And these are the markers and biosynthesis control the formation of the new mitochondria and the electron transport chain competence and directly influencing the ATP generation required for the oocyte maturation and mitochondrial genome integrity, optimal empty DNA copy numbers, and low level of the empty DNA fragmentation are essential for the normal oxphos activity, and genomic instability impair the spinal function and reduces the development of the competence. And mitochondrial ultrasonal structure, the crescent density, membrane organization in the mitochondrial mass determine the biogenic genetic capacity, and structural disruption reflect the poor cytoplasmic maturation and the reduce the ATP outcome. What will happen in the mitochondrial dynamics, the fusion and fission balance. You see the mediated by the markers, and these are the marker FN1 1 by 2 and OPA1 and DRP1 and the FIS1. Healthy dynamics ensure the proper mitochondrial distribution and repair. Imbalance lead to the fragmented low performance of the mitochondria. What will happen? The reactive oxygen specific handling and repair of the mechanism. Mitochondria generate ROS during the oxphos. Excessive ROS damages the lipids, protein, and the mtDNA. Robust antioxidant defensive, the preserve the redox balance and the protect the oocyte quality. What is the effect of the metabolic outcome of the ATP production? ATP generated via the Oxford powers GVBD and milk transition, spindle assembly, fertilization, and the early embryo cleavage. Mitochondrial membrane potentially is the direct marker of the metabolic competency. So, the mitochondrial biogenesis, genome integrity, and the ultrastructure dynamics, rose control, and the ATP output, all these things collectively determine the oocyte competency far beyond the age or the anti-mullerian hormone levels alone. So, dear friends, I have talked about the female infertility. Now we will come to the male infertility. Two causes are there: endogenous or the exogenous. Endogenic leukocytes, immature abnormal spermatozoa, and Sertoli cells and the varicocele. These are the endogenous sources, and exogenous sources: environmental pollution, radiation, unhealthy diet, or the nutrition, or the malnutrition, or the lifestyle factors I have told you. The very corporate culture and the overnight night duties and all that, there will be lifestyle factors that will lead to the infertility in the male. So, oxidative stress and the male infertility, do antioxidants really matter in the male infertility? Yes. Understanding the science behind the male reproductive health, you see why the male infertility matters. Male factor contributes around about 40 to 50%. I told you in the beginning of the infertility cases, and large proportion of the remains the idiopathic, no cause is there. But nowadays, lifestyle and the metabolic disorder increasing day by day. You see, due to the modern era or the corporate culture, high speed life. So these all will lead to the infertility. Infertility. So oxidative stresses plays a central role. And what is the oxidative stresses? That the imbalance between the reactive ROC or the body's antioxidant defense system. So the physiological ROS required for the sperm function, and excess ROS causes the cellular damage in the sperm and will lead to the pathophysiology in the male infertility. Other causes, that is smoking, obesity, varicocele, these are the important in the male infertility, and increased ROS and DNA fragmentation and the lipid peroxidation and impair the sperm function. So very, very important. So effect of the sperm parameters, what will happen? They will decrease the mortality, that is the asthenospermia, decrease mortality, increase the DNA fragmentation index, and mitochondrial dysfunction. All will lead to the infertility. So, other abnormal morphology of the sperm is very, very important for the infertility. And role of the antioxidant, vitamin C and vitamin E, and coenzyme 10, and an acetylcysteine, zinc, and selenium. These are the antioxidant and neutralize free radical or the improve the mitochondrial function. And do antioxidant really helps? Definitely. Some randomized controlled trials show the improvement in the sperm parameters and benefits seen in the selected subfertile man, and evidence remains the heterogeneity and not universally guidance recommendation. So, clinical take-home message for the male infertility: oxidative stress is significantly affect the male fertility, and antioxidant may help the selected patient, and lifestyle correction is fundamental, and rational and the evidence-based prescription is very, very essential. Another one, what is the therapeutic gap? Why the current approaches fails to crack the biogenetic declines? So these are the current therapeutic strategy, improve the symptom, but do not crack the core defect, that is the mitochondrial and the NAD depletion within the oocytes. So the lifestyle modification and the weight reduction, very, very important. That is a no direct enhancement of the mitochondrial, that will not come into the this picture. So does not increase the DNA copy number of the ATP production and limit the impact on the follicle reduction. So if you give the metformin in the PCOS, then minimal influence on the mitochondrial biogenesis, that is a PGIC1 alpha or the NRF1 pathway, and does not distort the oocytes, NAD levels, and inadequate correction of the gliosomal cells, oxidative injury, and ovulation induction agents like the latrozoles or the clomiphene we are using nowadays do not modify the cytoplasmic maturation or the mitochondrial distribution, and no improvement of the ATP dependent meiotic spindle stability or the outcome healthy dependent on the pre-existing oocyte quality, and conventional or the antioxidant, that is a conventional vitamin E, C, melatonin or the CoQ10 enzyme do not activate the SIRT and the PGC1 alpha axis, and do not support the mitochondrial replication or the electron transport chain efficacy, that the limit impact on the fusion and the fission dynamics of the mitochondrial repair mechanism, and ultimately no current therapy targets the immunometabolic drivers as I have told in the between. So the TLR, NRF2, and the SREBP lipid modulating remains unaddressed, and there is the NK or the tract imbalance persists, impairing the implantation of the microenvironment. Chronic metabolic inflammation continue to compromise the follicular physiology. So, despite the multiple treatment modalities, don't restore the mitochondrial competence. That is very, very important. The core driver of the oocyte quality. So, what will happen? We will give the evidence-based nutraceutical pathway impacting the oocyte bioenergetic. So, what will the that is a NMN that is a NM, that is a NM, that will restore the NAD and the mitochondrial revitalization and directly replenish the NAD or the core cofactor of the oocyte energy metabolism, activate the T1 and the improve the oxphos mechanism or the ATP generation, and enhancing the mycotic spindle quality and the embryonic development potential. So, if we give the still bands resveratrol or the taro stimulates mitochondrial biogenesis. It will increase stimulate the SIRT1 or the PGAC1 1 alpha signaling, increase the mitochondrial mass and the efficacy, and reduce the oxidative injury production or the uh, mtDNA, improve the cytoplasmic maturation. So it will also support the granulosa granulosa cell metabolism reliance. And what will happen if we give the EGCG redox modulation or the metabolic stabilization? That is a potent ROS scavenging within the follicular fluid and modulates the NF, KB, or the JAK stat. These are the markers reducing the metabolic inflammation. So there is the inflammatory marker. And or other cytokines. And sports, the AMPK drivers mitochondrial remodeling. So if you give the immunomodulator, that is the rhabdosia or the cymarosa immune metabolic balance, that will reduce the TH1 dominating cytokines, that is the TNF or the alpha or the IL-6, that is the enhance the tract mediated tolerance with the ovarian microtrend and stabilize the granulosa and the commerce cells function under the oxidative stresses. So ultimately, these pathways collectively enhance the mitochondrial health, that is the redox stability and the immunometabolically balance, the core determinants of the oocytes competent and the immune quality. So what we require as the Metrola Udra, that will improve the oocytes maturity and the component, the higher ATP availability, and support the GVBD and MI, and second transition and the spinal integrity. So that will also reduce the oxidative damages and the fragmentation, lower the ROS, and protects the mtDNA and reduces the cytoplasmic or the embryonic fragmentation. So that will also help the higher the blastocyte formation rate, enhance the mitochondrial performance, sustain the embryo development throughout the compaction or the blastolation, and enhance the implantation potentially, better immune metabolic balance, improve the endometrial receptivity and the trophoblast invasion. So what we require, what we need, the PP for the protection from the OS, that is the true dust stillbands, or the EGCG and the ovarian reserve, both will work, and wellness and the endometrial hormone, both the Simarova or the Rhabdosia, and energy, that is the NMN, or that will increase the NAD or the ATP, and receptivity and the immune balance, that is the Simaroba and the Rhabdosia. So all should be in the one pill, that will increase the adherence and the compliance of the treatment. So this should become in the one pill only. So dear friends, I hope to meet all the we require antioxidant which contains all in one, because if one pill is there, then we can increase the adherence to the compliance of the patient for the impurity in the both male as well as the female. So dear friends, in the last, I will tell you the superior doctors prevent the disease. Mediocre doctors treat the disease when before the evidence, and inferior doctors treat the full-blown disease. So, dear friends, take a message. Be stay with the superior doctor. So you should prevent the disease before doing the infertility. You should prevent the infertility with the both male and the female. So if there is evidence. So thank you very much. Over to the organizer for the question answer.
Yes, delegates, if you have any questions, please drop on your chat. Dr. Saab is ready for the answers. No, sir, there are no live questions. Maybe doctors have their questions, so we will discuss later on with you. And
Anybody want
but
any
if
question, then you
yes,
can email either to Surashi or to direct me. I will answer the question. You give your email ID, Vicky. email ID
yes,
और
sir,
phone number. You give your
sure, sir,
और नंबर दे दीजिए. रिपीट कर
sure,
दीजिए
sir.
नंबर.
Sure, sir. I will put the I will send your number to each and every doctors and your mail ID too, so
ठीक
they
है, आप
can
मेरा भी
put
दे
their
दीजिए, उनका भी दे
queries.
दीजिए.
Yes,
आपका सुरक्षित
yes,
का भी
sir.
दे दीजिए. और आपके पास
Right,
आते
sir.
तो मेरे को ऐड कर दीजिए, मैं आपको आंसर कर दूंगा.
Right, sir. Right, sir. So thanks, Dr. Aram Shabda. On the behalf of entire Surushi team, I would like to extend our heartfelt thanks to Dr. Aram Chabla for delivering such an insightful and engaging session on oxidative stress and infertility. Your experience and practical insights have truly enriched our understanding on this important topic. Uh, so you have already discussed, Doctor, regarding beta-nicotinamide, mononucleotide, trans-resveratrol, trans-terostilbin, simaruba, rhabdosia rubicins, epicallocatechin gallate. So these all ingredients we are giving in a single pill, that is Mitov. Mitov is a India's first mitochondrial optimizer to treat female infertility and subfertility. So doctors can prescribe in PCOS, ovulatory dysfunction, low ovarian reserve, endometriosis, unexplained infertility, recurrent pregnancy loss, recurrent pre IVF and pre IUI preparation also. Dose is first month BD and second month OD. Mitov is available in India market now. The patients can take after prior prescriptions of doctors. And we do have another brand, our Estacocutan for male partner. In male partners, Estacocutan improves sperm movement, strength, and DNA integrity. So it is useful in idiopathic and oxidative stress related male infertility. Astacocutan also provides essential nutrients like folate, vitamin B12, B6, zinc, and omega 3, which are important for overall fertility health. So, Astacocutan and Mitop, both the brands are available in India, and a big thanks to all doctors for joining and making this session interactive. Lastly, thanks to all our organizing team for putting this together seamlessly. We look forward to bringing you more such scientific session with Dr. Chabra in the future. Thanks, Dr. Chabra, and thank you, team. Thank to all delegates. Thank you, Surushi, for this insightful session. Thank you.
Vicky, I think this is the first theming.
Yes, first webinar, sir, we have planned,
May God
and
bless you, the successful, not successful, I think. और आपको मैं बेस्ट विशेष करता हूँ कि आगे भी इस तरह करते रहिए और आपकी सक्सेसफुल रहे. बेस्ट विशेष फ्रॉम
thank
माय
you,
साइड.
doctor. Thank you,
राहुल
doctor.
जी, थैंक यू
Thank you so
आपको
much.
भी.
Thank you so much, sir.
ओके.
Thank you.